So we'll try to finish up the rotator cuff section today. And why don't we start with this one, Shiv?
Okay, so it looks like there's some hyperintense signal within the supraspinatus on the sagittal view.
In here?
There, yep.
Okay. Maybe here and here.
The superior infraspinatus as well, yeah. Oh,
So that's kind of the same thing there. What is this?
Is it a torn piece of muscle that's sort of inferiorly directed?
Right. Okay, well, you should know this. This is a variant anatomy, and it's a strain of that muscle.
Okay.
Don't ask me to pronounce it.
All right.
Okay. Sahar, what do you think of this case?
Zero male with pain radiating down the arm 5 months after treatment followed up rotator tear. I see some edema in the supraspinatus, some low-grade Deltoid Tear of the supraspinatus, and also there's some edema in the deltoid.
But yeah, so the tendon here actually looks pretty good. It looks like the edema is peripheral to the supraspinatus anyway. Here's some other images.
Yeah, it seems that there's like partial tearing of the deltoid.
Yeah, that was a deltoid strain. Now let me just check. No, Thomas isn't with us yet. So, and here's a case where you have someone with acute shoulder pain, and you can see edema within the deltoid, edema posteriorly here, also a little bit here within the teres minor as well. And this was another tear, traumatic tear. Okay. Shiv?
Okay.
This is also a traumatic injury.
All right. It looks like we're further down now in the. It looks like the humerus is there, and I'm looking for the attachment of the pec. The ligament of the pec looks like that's intact there. So, yeah, it looks like there's a tear of a muscle there, and is that the long head biceps? Is that the biceps?
Well, the triceps can come up in this area. You've got the teres major, and you've got the latissimus dorsi.
Okay.
I want to think about this was a teres major tear. Okay. Sahar, what do you think of this?
Okay, strain, water skiing. So I see some edema again. It's more medial. Is it Latissimus Dorsi? Or there's like tear.
Yeah. And notice how this is going down toward the chest wall here. And this was a latissimus dorsi strain. Okay. Okay. If we look here, it looks like there's some fluid, a lot of irregularity here inferior to the capsule. Here's the capsule in this location. So we're still kind of in that same category, and we can see in there. If we look here, we can follow the hemorrhage more distally and medially. And this was a combined conjoined tendon tear, the latissimus dorsi and teres major of Bostov.
Was that a normal capsule, John?
But we only have a fat-sided image. I think that's a fairly normal capsule right in through here. This is obviously the area. This is where the avulsion occurred right here.
Yeah. Okay. Thank you.
Yep. Okay, and if we look at the anatomy here, the teres major is down here, which we can see here is the teres major tendon. It where this is a posterior. I'm sorry. Okay. Yeah, it's a posterior view, and we can see where it attaches along here, and it really pulls medially, and here we can see. Here's the. This was a study where they were looking for a labral tear. What do you think of this one, Shiv?
So it looks like there's hyperintense signal. I believe that's the Teres major there.
Yeah, it's in. You have to kind of look at the Teres major. Again, you have to think. Sometimes you have to be careful and follow where it goes.
Mm-hmm.
And if you can't follow where it goes all the way on the images because the images don't extend far enough, then sometimes atlases are helpful. But you were talking about Teres major, Latissimus Dorsi, and the triceps in this particular area. And here on the sagittal images, we can see the area down here, and here we've got a lot of edema. And this was another Teres major tear. So kind of looking at the anatomy, let's see. Great. We saw the Teres major before coming across here. And here's the long head of the triceps coming up here. And then if you overlay the deltoid overlays it all here. So this is the triceps, the Teres major coming across here. And deep in here is the Latissimus Dorsi. So if we, which is down here, which comes up obviously from the chest wall and comes up and attaches in a conjoined tendon with the Teres major attachment right here to the humerus along here. And so this is the Latissimus Dorsi muscle. It's a big expanse, basically covering the back of the rib cage, and comes up and attaches to the humerus here, right next to the attachment for the Teres major. And then if we look at it here, here's the long head of the biceps tendon, the intertuberous groove here, where this is a little distal to the intertuberous groove. Here's the long head of the biceps tendon. The Pectoralis major is anterior. The Latissimus Dorsi and Teres major are posterior to the biceps tendon at their locations. And it just shows how it kind of folds up here and attaches in a broad band here on the humerus. Okay. So, Har, what do you think of this case?
A 43-year-old male shoulder pain volleyball injury 4 weeks ago. I see some edema along the, looks like Latissimus Dorsi, I believe.
Right there.
The partial tearing.
Okay. And then here are the axial images. And we actually see 2 areas of edema there and there. And then here's a sagittal, and we can see edema within the muscles down here. Oops. I guess I don't have the judgment, but this was a strain of both the Latissimus Dorsi and the Teres major muscles. Here's a 22 acute on chronic, fell catching a ball playing cricket. But here we can see a very chronic hyperostotic bone formation here, kind of a balled up mass down in this area where the Teres major and the Latissimus Dorsi would attach to the humerus. Here are the axial images showing the hypertrophic bone formation and all of the scar tissue in this location. And here we can see at the attachment site this hypertrophic bone formation. This is what the CT scan and the plane radiographs look like. And this was a chronic tear where it healed by hypertrophic bone and ossification of the bone growing into the tendon, as we've talked about many times before. Okay, Shiv?
28-year-old MLB pitcher with inferior shoulder pain. So I'm not sure if it's artifact, but I see a little bit of a hyperintense sort of linear signal at the yep, right there.
Okay, that's one cut. Here's the next cut. Here's the next cut. Here's another plane.
Okay, so is this the triceps? Long into the triceps.
And then this goes more. So here we're in the axial plane. It's coming back in this area.
Okay,
yeah.
So this is Latissimus Dorsi then.
Yeah, so when you're dealing with a baseball player, an important muscle to them, the one that's very uncommonly, but more commonly than most other muscles, torn, is the latissimus dorsi. Because as we talked about before, the two muscles that are really most important in pitching speed are the teres major and the latissimus dorsi. It's an important muscle in baseball, and this is really a tear of the teres major and the latissimus dorsi down there. Then they commonly torn together because they're torn by the same mechanism. As you know, as we just talked about, their tendons attach really very closely to one another. Sometimes, usually, it's really a conjoined tendon. Okay. Sahar, what do you think of this case?
Left shoulder pain. I see increasing on intensity in the superior left shoulder. I'm not sure which muscle is that.
This one?
Yeah.
Okay. Here's a sagittal through it. So what's going on?
There's some increasing in the deltoid. Also, there's some avulsion of the.
Oh, wait a second. The deltoid is not really here. The deltoid's over here. The deltoid's not in this image. So I guess so the question is, what muscle is this? This is a muscle tear, right? And then we can see the edema. So what muscle is that?
It's inferior. Is it okay.
Yeah, so that's the trapezius tear. So basically, the take home is any muscle can be torn. They all pretty much look the same. So some are
Teres, trapezius stabilizes the scapula and in turn the shoulder.
Yeah. Okay. Sure.
All right, 44-year-old male unable to lift arm, rule out cuff tear. So I see, I believe that's hyperintense signal of the deltoid superior limb right there, or is
that's
is that
coil
artifact?
artifact?
That's artifact.
So it's bright coil in that location. Okay, a little thing here, funny thing there, with the long head of the biceps.
Mm-hmm.
And we're not really getting a good view of the supraspinatus here.
Mm-hmm.
Here's the axial images.
Okay, so I see high signal, and then it looks like it.
Yeah, there probably is some edema down in here.
Okay. So I see a tendon with some high signal adjacent to it.
You're talking about this one here?
Yep.
Okay, that's really a long head of the biceps in that area.
Okay, so I'm thinking, could that be the pec that's torn and retracted?
Yeah, so we saw one of these this morning.
Yeah.
This is a pectoralis major tear. The pectoralis major tendon comes over the top of the biceps and attaches here. The latissimus dorsi and teres major attached back here. And this has been torn and retracted. And what's the importance of an MR scan here?
So it's surgical if it's torn at the.
So this is a tear of the tendon off of the bone, and that's retracted. Here is tendon here, and the musculotendinous junction is retracted back to there. Since the tear is between the tendon and the bone, these are normally surgically repaired. If the tear were around the muscle, it's usually not surgical, as we've talked about, because you really can't suture in the muscle very well. Okay, Sahara?
Okay, shoulder pain after injury in Australian football game. I see. I think that there is like a torn muscle. I think is it pectoralis minor?
Talking about this right in here? Is this what you're talking about?
Yes.
Okay. Here are the sagittal images.
Okay, yeah, again, I see that torn muscle. I think this is
Right up here. There's another coronal image.
yeah, I think it's the walls from the coracoid attachment.
Yeah, so this is the tear of the pectoralis minor tendon. Good. All right, well, that's the end of the rotator cuff. Now, what I'm going to do is go ahead and